Good evening, I'm Alicia Richards. Valerie has the night off. An unprecedented rise in respiratory viruses in children is overwhelming hospitals locally and around the country. Sarah Wilson joins us with our top story tonight. Sarah.
Alicia, it's a virus anyone can get, but kids under 5 who contract it are more likely to suffer serious illness. And health experts across the Midstate say right now that is exactly what's happening. It's called respiratory syncytial virus, also known as RSV.
The virus itself affects the smallest airways in the lungs. And so, when you have those small little airways filled with mucus, there's really not much space for there to be oxygen, flowing back and forth the way it's supposed to.
Infections usually start to rise in November, but not this year.
Because we had fewer people infected over the last couple of seasons, it's coming back with a bit of a vengeance.
UPMC says it's seen a large increase in kids going to the ER, even the intensive care unit, for the virus.
And I think what happens is that we have been masking social distancing, so there's less pre-existing immunity in the population. And as a result, RSV spreads more quickly and causes more severe disease.
In some cases, hospitals are so overwhelmed, patients need to be transferred to other hospitals.
Our pediatric floor in York Hospital was full last week. And I know trying to admit a patient from here, Hershey was full, LGH was also full. The closest bed I could get was King of Prussia.
Health experts emphasize that severe illness from RSV is rare, but recognize it can have a serious impact on kids under 5 and the elderly. So, if you want to protect yourself,
it's very easy to contract. We just have to use the normal ways of, if someone's sick, don't go near them. If you're sick, don't go out. Washing hands, keeping, surfaces as clean as possible, but it's very easily transmittable.
Doctors say RSV presents itself just like a regular cold, but parents and caretakers should watch out for signs of respiratory distress. Things like shortness of breath, decreased appetite, and irritability are also other symptoms. In the newsroom, Sarah Wilson, ABC 27 News. Alicia, back to you.
Yep, Sarah, thank you so much.